Hi, I'm Darren Bernard, a physiotherapist. I'm here with Jonathan Walczak, who's a consultant orthopaedic surgeon. Welcome to the Patient Series. Today we're going to talk about a potential, it's small, but the possibility after a total hip replacement that someone can have something called a leg length discrepancy. This just means one leg can be slightly longer than the other. Jonathan, I'm sure you're aware that leg length discrepancy is not common. Between 1 and 27% of surgeries in the US, and that on average the leg length discrepancy is of 17 millimetres.
Absolutely.
What's your views on leg length discrepancy?
First of all, hello young man, nice to see you. Good afternoon.
I think it's not uncommon, but it's usually not a problem the patient is going to be bothered with long term. They've been used to a leg that's shorter before the surgery because the hip has collapsed up, because the muscles have gathered in front of the hip, and it'll always feel longer afterwards, even if it's precisely the same length. But providing it's within a centimetre of the other leg, you won't be bothered by it long term. Yeah. If it's 1 to 2 centimetres, or the 17 mil you mentioned there, then some people are and some people are not. If it's more than 2 centimetres, then most people are. So I think the crucial thing is don't worry. It always feels longer for a few weeks. Do the physiotherapy, stretch out your muscles, let your body relax into the new joint, and most people who felt much longer will not be longer. The small number of people who need to have a shoe raised, then will do that later on, 3 months or more. That's certainly a potential, but it's quite rare.
Yeah, I've seen it very rarely. Do you find people that have leg length discrepancies are always going to limp, or what do you see?
No, I think that's a good question. The reason for limping obviously is at least twofold. As you and I both know, the muscles have been weak before surgery. People have learnt an adaptive gait that's wrong,
Yeah.
and then the muscles have been cut and attached to whatever surgical approach you use. So there's a triple whammy. The muscles need to be strong again, particularly the glutes, the side muscles here,
Yes.
and you would take great care to give patients those feedbacks and exercises there. Once they're stronger, a lot of the limp will go, and in that case you can disentangle what's weak muscles from what's longer leg. And if it's 2 centimetres or more longer, then fair dues, you might need to have treatment. But really, 99 times out of 100, it's time, physiotherapy and patience, and things get better.
Mm-hmm. Yeah, so you basically answered the next question. What's the likelihood of having to have a shoe raise because of a leg length discrepancy?
I'd certainly say, as you say, in large studies it varies significantly on that. I'd say it's certainly within a single figure percentage, 1 to 2%, and you really want to make sure you don't rush too soon for it. The one circumstance I'd be more specific is if your other hip is also worn. Once you bring the first hip back to where it should be, the other hip is still very short.
Yes.
I operated this week on a lady who had a congenital hip problem, whose legs are extremely short. Did one hip before lockdown, had to wait till after, poor lady. Now her legs are perfectly the same length, and she spent 3 months with a big difference. So if the other hip is bad, you might need a shoe raise temporarily. Once both are done, you're golden.
Brilliant. So there it is. When Jonathan operates, yes, it's going to change the biomechanics because things have changed in the degenerative process. You just need to persevere with it, and 3 months later should be fine. Not many people will need a shoe raise. Thanks for watching.
Many thanks. Good to see you.